Well, I think we will go ahead and get started. So welcome everyone. My name is Beth Feely and welcome to Nutria Neighbors' first ever virtual town hall. I am on the board of Nutria Neighbors, and as many of you on the call know, we are a neighborhood organization that promotes the ideas of common sense, free enterprise, and the golden rule in and around the North Shore. We have about 2,000 people on our mailing list with whom we share information from time to time through a newsletter that we send via email. We also hold special events and host speakers. And you can check out more about our organization at nutrianeighbors.org. And there you can sign up for our newsletter and also donate if you would like. So given that we are all holed up at home, we thought we too would go virtual. And we've invited tonight two of our Nutria Neighbors board members to share their perspectives on how COVID-19 is affecting our area and our state. First, we're going to hear from Dr. Carrie Mendoza, who is an MD, and she serves as an ER doctor on the south side of Chicago. You may have read her op-ed that she recently penned in the Chicago Tribune that describes into some of the perspectives that she has just based on the last month. And she'll talk more about those in her presentation. And so after Carrie, we will then hear from Ted Dabrowski, who is president of WirePoints, and he's going to share a little about the financial implications of COVID-19 for Illinois. Ted is president of WirePoints, and he and his colleagues are the best source for financial information on Illinois. So before we hear from Carrie and Ted, I'd like to invite Betsy Hart, another board member of Nutria Neighbors, who is going to let you know a little bit of how the call will work technically, how you can answer questions, etc. So Betsy.
Okay, welcome everybody. So glad that you're here with us tonight. This is a great way to do business since we can't all actually be together. As our panelists are speaking, we will be very happy to take your questions, and feel free to send them even as they're talking, because then we can sort of get them into a queue, and I will go ahead and ask some of the panelists when they're done speaking. If you're very particular about talking to one panelist or the other, just make sure you direct your question so that we can know for whom it is intended. And I think at this point, we're just going to turn it over to Carrie. This meeting is being recorded, by the way. A couple of you have already asked about that, and we're just glad you're here. Again, feel free to communicate. I'll be managing the messaging and the questions while Carrie is speaking. And now we're going to turn it over to Dr. Carrie Mendoza. And Carrie, we're so grateful that you are serving on the front lines during the COVID-19 crisis in ER rooms. And I know we're going to have a lot of people interested in the stories you have to share. So over to you. Carrie, I'm having trouble hearing you. Can you make sure that we can hear you? There you go. Try again.
Okay, there we go. Okay, just wanted to say thanks to everyone for joining, and appreciate your interest in what we're doing and hearing what we have to say tonight. Just to let you know, I'm just going to go through a few slides and then just leave some time for questions, and then we'll have Ted do his presentation. So I'm just going to share my screen here. So, as Betsy and Beth were saying, I'm an emergency medicine physician. I work within the advocate system, and I've been practicing emergency medicine for nearly 20 years. And so I just wanted to share with you what I've been seeing in the emergency department. So, when this started out in January, our question was, well, who has, COVID? And in January and early February, really, we felt no one had it. It seemed like it was, if you had a travel history in China, and then it became closer in Europe, but it just didn't seem on the south side of Chicago that was, anything that fit the profile of the patients I would see. And then as it evolved, into March, and certainly now, it was basically became a situation where everyone seemed to have it because it was a widespread in the community. And so from the hospital standpoint in the ER, it really evolved into, how do we keep the staff safe? How do we keep how do we identify the patients correctly? And how do we prepare for a surge? So there really was extreme stress from the physician and staff perspective, because we kind of realized that, probably a month prior, it was really in the community, and we really probably had all been exposed, certainly to patients that we thought probably had influenza, but probably really had COVID. And then, now we have really developed, basically wearing our protective gear, all day, because pretty much every patient, we assume, has it. And the testing really evolved. First, it was just a clinical diagnosis, meaning we would approach a patient in terms of their risk profile and kind of say, hey, they probably have it. And if they needed to be admitted, they were admitted as what's called a patient under investigation. And we could only get testing through the Illinois Department of Public Health, and the results would come back 3 to 4 days later. So the patients would be just sitting in the hospital waiting. Now we have in-house testing, both rapid, means returns in about 2 hours, as well as a test that takes about 24 hours. So that's streamlined the efficiency of how the hospital's been organized and divided up into different units that are treating the COVID patients or ones suspected for it. So within the Advocate Aurora system, which is the largest in Illinois, and they combined with Aurora up in Wisconsin, the fear really evolved into just routine care now with clear protocols. And we really approach the patients as, either mild cases that have upper respiratory symptoms that can go home. There's moderate cases where they might have mildly low oxygen levels and need to be admitted. And then the severe patients, which luckily have been fewer and fewer, that have very severe oxygen depression that might need to have a breathing tube placed. Within the Advocate system, our peak admissions were really back on April 7th. And we've been slowly declining. If you see on the far left at the bottom, the graph, there's a slow decline, obviously, slower than the increase up for the admissions. And there's been about 310 fatalities within the Advocate system, and we have less and less staff quarantines. So from the Illinois Department of Public Health site, which is full of great data, it shows you the deaths, the positive patients. When we look back and say, well, how did this all start with the quarantine or with the shutdown, widespread shutdown? It was really to make sure that we could adequately handle a surge in the hospital and as well have the adequate staffing. And we really have shown that we organize ourselves very quickly, and we clearly have the capacity for, enough ICU beds, enough doctors, enough ventilators. And part of that is, we didn't really know what the situation was going to be. And so we were over-prepared, thank God. But we've also evolved in our treatment, where a lot of patients now can be bridged with other oxygen support devices aside from needing to be intubated. And so we had overflow tents built out in our parking lots, and those all have been closed. We had only a few patients each day. Our overall volume in the ER has decreased quite a bit, 37% compared to last year. Also, telemedicine has been a huge help. President Trump changed or decreased a lot of regulations, so we've been able to have the outpatient doctors really help see patients that otherwise would be coming in the hospital. And the widespread testing has been great because patients really want to know what their status is. So, is it safe to go to the hospital back in the community? I certainly think so. I think the right metric is to look at, can the hospital handle an increased surge if there was a bump up? And I certainly think that it can. So I just wanted to end with that and open up to any questions that folks might have. So I'm gonna go back here.
Great, Carrie, can you see me?
Yep.
Okay, so we're getting some good questions. Feel free to send them along. Lots of people who want to thank you for your service on the front lines. And then one of our guests wants to know, why does Governor Pritzker say that the surge isn't going to be until the middle of May, and you're saying it was the last week, or was April 7th?
You know, I'm not, entirely sure. What I can tell you is, as I presented what is going on inside the hospital, I think that there's a lot of mild cases that are basically, able to just do self-care at home or are being treated in the outpatient setting. So to me, surge means, again, can the hospital handle the sickest patients? And I don't see, right now, even if it's spreading out and more people are getting infected, most people do well. And so I think that I just am not seeing that. We were told the surge was going to be, in mid-April. And I think, as I, have showed with advocate data and what I personally experienced, I think that was accurate. So I can't say exactly, but this is kind of what I'm seeing on the front lines.
Okay. And here's another one. Can you tell us a little bit about, you said there were 300 deaths. Can you tell us a little about the age and the comorbidities of the patients who tragically passed away?
Sure. Really it is, older patients with a lot of comorbidities, which means other medical conditions that they're already been diagnosed with and treated with. On the south side of Chicago, again, where I primarily practice, there is a lot of high blood pressure, a lot of diabetes, a lot of obesity, a lot of patients on dialysis. And so really it is patients with those various different, at least one or two comorbidities that seem to be definitely in that moderate, sicker range where their oxygen goes lower, and, the ones that unfortunately have succumbed. We've had very, very few patients that are younger that have had, no medical problems that have gotten sicker. So it really is kind of that profile that you're reading about in the media.
Okay, a few more questions. I'm going to try to take a couple at a time. Why are we, Darlene wants to know, why are we not doing more testing for antibodies? And Juark wants to know, what is the benefit of testing at all if someone can be free of the virus one day, but then catch it later?
Yeah, great questions. I mean, so for the first one, the antibody test, I mean, really it's just about getting the test developed and making sure they validate, the testing that like a true positive is positive and a true negative is negative. And with antibodies, it's really trying to understand what is that level at which you get immunity from it. And we really don't know because it's a new disease. So that's really what it is. I think as a clinician, I mean, I'm going to be probably, one of the first people to be able to get the antibody testing. And so I will certainly share what I learned from that. But that brings into the second question about the broad spectrum testing. I feel that, it's really, it's sort of focused on, I think it's inappropriately in terms of given too much value, because to the questioner's point, if you were negative, last week, but now you have symptoms, and you get a test and then you're positive. So it really is based on what are your symptoms, and the logic around testing when it started and now is testing people who have symptoms. If you don't have symptoms, you should be negative. If you have symptoms and you're negative, then the question is, well, is it a true negative? And that gets into the quality of the different tests. So it's really a more complicated issue. It's not just like, hey, testing for everybody. It's like, what is the quality of the test? Do you have symptoms? And then what are you going to do with that information? I mean, in the end, if you have symptoms, you should not be out and about coughing and sneezing on people, and if you are feeling sicker, to the point that you are feeling like it's hard to breathe, you need to seek medical attention. So yeah, it doesn't really change a lot with the management right now, except, initially helping the hospital sort of segregate patients.
Interesting. Okay, we're going to combine a few more so that we can get to Ted.
Okay.
We have, let's see, we've had a few people ask, are you worried about passing this on to your children? Do you see a dip in people coming in for non-COVID reasons? We've heard about people being scared away from coming to the hospitals. Is that kind of your experience?
Yeah, so for the first thing, yeah, with my family, for sure, when it all started, and as I was trying to say, there was this whole like trying to use, sort of the risk factors to determine if we thought someone had it, because we didn't have testing. And so then you retrospectively learn that, oh God, the hospital decided that was a patient that was of concern, and you initially didn't have all the proper gear on. So yeah, initially it was very, very scary. But now with all the, knowing how to protect myself at work, and in the emergency department, we have all the cleaning supplies, everything. I'm really not scared, and we have protocols that anesthesia helps us put a breathing tube down because they have a special system they use. So the hospital's really organized itself around the safety. So I'm less concerned. I mean, I change at the hospital. I take a shower right when I get home, and just the common sense precautions. And then the second question, did decrease volumes in the ER? Yes, it absolutely has. We've had a 30% decrease in our volume, and we do wonder, like, where are all the heart attacks, where are all the strokes that we see? But I have in the past week started to see an uptick, because I just don't think patients, I mean, a lot of people are just out and about, especially younger people. And we have started to see just an increase in volume of the regular things like heart attacks, strokes. So I think that, what the government wants to do is going to be one thing. I think what people are actually starting to do is different. And, I'm thankful that our hospital system is organized to handle the non-COVID patients as well as the COVID patients.
All right, and that sort of segues into Ted, but before we do, I want to get to one more question, and we'll have a few more where we can kind of have a discussion between Ted and Carrie. But Michelle wants to know, something we've heard about is strokes in younger patients and blood clotting issues. Have you seen any of those things on the front lines?
So yeah, that's, well, what I can say is I do see that it's starting to get out there in the popular press. So from the clotting perspective, the patients that are severely ill, it's sort of a common endpoint that the body is just this overdrive of inflammation. And they are starting to see that in these very, very sick patients, that they may have blood clots in the lungs and blood clots in their small vessels, like in their extremities. But this is very, very sick patients. Patients, like, if, it's the patients in the ICU. So it's not patients with mild symptoms that are just also like coming in with a stroke. That is not described at all, and we are not seeing that.
Okay.
So.
All right, thank you, Karen. Thanks again for your service. If we did not get to your question, we will actually try to do so after TED Talks, or otherwise make a way for us to allow Carrie to answer. But we do need to move on at this point and introduce our next speaker. So I will turn it over to Beth for that.
So, as we mentioned earlier, Ted Dabrowski is a New Neighbors board member, and he is also the president of WirePoints and has been producing many wonderful articles. We sent one around earlier today that just really tell you what the regular press is not telling you. And so with that, Ted, we look forward to hearing from you and your insights on the financial implications of COVID and other information.
Great. Well, thank you everybody for joining, and thanks for taking your time late at night to do this. So, I have the difficult task of typically talking about how bad Illinois' finances are. And, there's a lot of problems we've had for decades. People are leaving the state. The debts are huge. The pension's a problem. taxes are too high. And so typically that's been my focus in trying to get reforms to fix that. But along has come this coronavirus, and it's whatever mess we had in Illinois is now massive. And some of you may have heard that the Senate Democratic Caucus from Illinois asked for like $42 billion as part of a bailout to pensions and other things from the federal government. And so the crisis is on. But as interesting as pensions and debts might be, I think really the bigger issue right now is what happens to this economy. When do we open up again? Do we have to stay shut down for a long time? And so as I looked at that issue, that was more pressing than the pension issue, which is going to be pressing all the time. But we looked at the data around hospitalizations, the economy as it relates to COVID-19. And so we put together these arguments, which, like many of you, a month and a half ago, we just didn't know what to expect. And nobody really knew. I mean, we saw what was happening in Europe and China, but we didn't know what was going to happen here. And so we accepted a shutdown, a full economic shutdown, and we all accepted staying at home. And the problem is now it's a month and a half later, and the question is, we have lots of data now. What do we do with that data? Does it change our behavior? Does it change our government's behavior? Does it change the rules? And so let me take you through a few slides on that. Assuming I can make this work suddenly. Okay. I'm going to share a few slides. And the first slide I want to share is just, this is the concern about Illinois. This slide is showing the credit scores. Think of a credit score, like everybody knows those. Think of the credit score of every state in the country. And Indiana, Iowa, Missouri, they're well-run states. They're all AAA. They're the best. They're the best states. They're the people you lend money to. You trust them. Mm-hmm. And down there at the very bottom of all the states is Illinois, and it's one notch above what's called junk. And so this is the problem we're having in Illinois. Can we afford, as a state that's already in massive trouble, can we afford to stay closed for a long time? Can we afford tax revenues not to come in? Can we afford businesses to start shutting down, being closed down, bankruptcies? Can we afford that? That's a big question. And the bigger question with that goes, if that happens, think about the implications that poverty, lower health, opioid abuse, things like that. So we'll come back to that at the end of my slides.
Hey, Ted, I'm not sure
we're not seeing
slides.
Yeah.
You're not seeing the slides?
We're slideless.
I gotcha. I'm glad that you told me that. And there's a reason why. Because if I don't hit share screen, it won't happen.
Yeah.
There we go.
Okay.
Okay, sorry about that. So now real quick, I'll let you see that, that data. So you'll see where up at the top, these are the credit scores, call them AAA is the best. The red down there at the bottom is junk. And so Illinois is one notch away from becoming a junk rated state. No state has ever been rated junk. So, this crisis has huge implications for that, for many reasons. And normally I'd be talking about the financial implications, but I talk about the people, health, and the viability of Illinois going forward. So let me take you through 7 common sense facts. Now, we were all fearful of what might happen at the beginning of this crisis, but now we've had almost nearly 2,000 deaths. Sad as that is, and that's, it's a tragedy no matter how you look at it. But we know a lot more about those deaths. The first thing we know, and I was always worried, am I going to die? Is my kid going to die? Who's going to die? Who's at risk? And what we know now is that 85% of the people who have passed away were 60 years or older. So it's really something really dangerous for the elderly. And you can see we've only had 2 people younger than 20 die in Illinois. So that's the good news, right? That our kids aren't at risk, at least not in the way we would normally think they would be. Only 10 age 20 to 29. So the good news is, bad news is the elderly. I have a mom, she's 80. I make sure to protect her, but the good news is that we know it's defined. It's not like everybody's at risk. And only 6% of the deaths are for the younger crowd. Now, what's very important and was already discussed earlier were comorbidities. So it's not just that the elderly at risk. It's actually more defined than that. It's actually, it's even further defined. 90% of those people who have died or who've been hospitalized have had a comorbidity, another underlying pre-existing problem, hypertension, diabetes. So really what we know is that that the group that this virus goes after is typically, well, it's anybody who's got an underlying cause, but in particular the elderly. So when we think about this disease and when we think about the economy and how do we open up again, we have to realize it's not like everybody needs to be scared and everybody needs to be quarantined. Really, this is the group we need to protect, and we need to do all kinds of stuff to protect this group. One other fact that I want to add to that is that 35% of the deaths in Illinois have happened in senior homes, retirement centers. And I think when we look back at this crisis, we'll remember that as one of the tragedies, because we couldn't control this disease from getting into retirement homes. But what it also does tell you is that, again, not everybody's at risk. It's not the general public that's at risk. It's the elderly, underlying causes, and in retirement homes. So as sad as that is, it should give us comfort that we could start to think about taking a little bit more personal risk as we go out back into the economy. Now, okay, so that's that part about who's at risk. The other point that Carrie mentioned is that our hospitals have done pretty well. Our huge fear when we watched Italy on TV was that our hospitals would just get overtaken. And the good news is in Illinois, we never got close to sorry, light goes off in this room. We never got close to our, even during the peak, whether it's happening now or a couple of weeks ago, we never got to the peak of using our resources. And you can see on this chart today that 70% of our ventilators have pretty much gone unused. You might recall that Governor Pritzker was angry with President Trump. He wanted up to 7,000 ventilators. Well, we never even got close to that number, and our usage has never gotten higher than a couple thousand or 1,000. So that's the good news, and that's the same news for hospital beds. I have that data if you guys want to see it later, but hospital beds and ICU beds. So the good news is we survived the peak, and that means we have availability. So if we want to reopen the economy, we have capacity, like Carrie said. The other part that's interesting, and most of us are here in the North Shore, so we're this map here is showing the density of deaths, and it's all been around here. But there's other parts of the states that have seen hardly anything. Very few cases, very few deaths, and so a big part of the question is, where do we need to be super strict about stay-at-home orders or opening up the economy, and where should we be stricter? And I think one of the key things we're seeing from this data is a one-size-fits-all doesn't make sense for the whole state. And we can start to be smarter about where we phase in openings versus where we have stricter, more restrictions. And now I turn over to the part that I would argue that the government is absolutely ignoring. The deaths from coronavirus are horrible, and we would want to limit them. If we could keep them to zero, that would be great. But what's happening is this: we've never done what we've done before. We've never shut down the economy like this. And most people don't, well, a lot of people don't think in economic terms, certainly not the health people, right? They are experts in health. They're thinking how to protect lives. The economics people look at poverty, they look at opioid abuse from recessions and depressions and say, wow, we better be careful, because if we don't protect this economy, we're gonna have more poverty, more alcohol, more domestic abuse, more suicides, more, again, opioid abuse. And in just 5 weeks, we've had 730,000 people file for unemployment. We have no idea what we're doing to this economy. We're wrecking the economy. And people like me are very, very cautious about taking a very complex system and just shutting it down. It's kind of like a body, right? A human body, it's a complex system. You don't mess with it. And 1 million people will soon be unemployed. And if the Federal Reserve of St. Louis is right, we'll have up to 2 million Illinois unemployed. And nobody seems to understand the impact. I would say the health experts who look at science and data refuse to look at the science and data of the economy. And so, this is a stat coming from, I think it was, I can't remember from whom it was, but, unemployment rates, higher unemployment rates mean more drug overdoses, more suicides. So we need to take the math and add it together. And so, the bottom line is this: we need to use all the data and put it together, not just one set of data, not just the other. But I think what is starting to point out when you look at these 7 things we looked at is that it's time to start opening up the economy. I think we can do it. We have to be smart about it. We have to seriously think about how to protect the elderly because they're the ones at risk. We have to really be smart about protecting them, quarantining them, giving them the best services we can to move forward. But we think we can start opening up again. Thank you.
Great, thanks, Ted. I wish we could, you could hear us applauding, but I don't. We do like finger snaps or something. Okay, so now we're going to get to some questions for Ted. And
Betsy, can I say one thing?
Yeah.
I forgot to say one thing. Yeah, I've been attacked a little bit from this email today from a few people, not many, saying that I'm not a doctor. What am I talking about? So I welcome challenges, and I respond to them. I welcome the challenges. So please don't hesitate.
Okay. And on that note, I think, Ted, you can let go of your screen, or we can just look at this last sad. There we go. Okay, great. So now we have several questions coming in, and we'll start with Ted. When do you think public schools will be back in session? I think this is a nervous parent of a 7th grader. So why don't you? Actually, I don't know.
Yeah, this has, I think, become highly politicized, and it kind of comes back to my comments. We have to make a big decision in this state and in this country. Do we close up everybody, shut down everything, so that we can protect some people? Or do we figure out how to quarantine and protect those who are really at risk so the rest of us can start to produce again and learn again and have a functioning society? If we could keep the place closed forever and having an economy and creating a value and people earning incomes and all that didn't matter, then we could do that. But what's happening now is we're keeping the economy closed for so long that we're going to have a bigger mess than we ever would have had from the coronavirus. So I would like to see schools opened up for sure. Again, we have to be smart about people who come home to their grandmothers. That's the big risk. And that's the biggest challenge. We should find out how to help them.
And that's another question is what is, and probably Carrie, you could speak to this too. What is a way that we can protect the most vulnerable populations? For instance, nursing homes. People will say, well, the people going in, the workers going in and out of there, go back home to their families. And if their families aren't locked down, then they pose a risk. Is there a logistical way to protect the most vulnerable without shutting down everybody?
Yeah, well, I think, first of all, you have to approach it from the fact that you're never going to have perfect 100%, protection, or 100% of, that there's no transmission. So I think you just really work hard at best practices, meaning in nursing facilities that the staff has adequate protective gear. That's to protect themselves, but it's also to protect them when they're going from room to room, that they're not, taking the virus to another room. I think also nursing homes and assisted livings, especially nursing homes, need to, sort of, rise to the occasion in the sense that they need to be aggressive about segregating patients, which they're starting to do. They also tend to have lower skilled staff there. And I think that, maybe reimbursements and changing some of the way they pay for staffing would help, because you need to have, I think, stronger clinical people. And then I think EMS, emergency services also, needs to be stricter. I've had emergency service folks, they're wearing N95s, but they go into nursing homes, they come out, they come to the hospital, they go somewhere else to someone's house, they come out, so sort of whether, some universal type, sort of protective suit they can wear, something like that. So those are just, again, common sense ways.
But to your point, it's not ever going to be a perfect world where you guys do this. Okay. All right. So we have a couple of questions. Go ahead.
Oh, just to add, just quickly, I'm not being facetious about this, but it would be a lot cheaper. I worry about the South Side multi-generational home where the kid comes home and the grandmother's there. It would be a lot cheaper, to put that person in a hotel for X number of days, and give them a really good service than closing down the whole economy. So I think it'd be a much smarter thing to really focus on them and give them really good quality care.
Okay, so like my kids are all with me in my house. Can I go to a hotel and get the oh, sorry, kidding. Okay, so moving right along. So for Ted, we're going to go to you, and first on Darlene wants to know, great question. Can the progressive tax put a dent in the problem? And then we have a question for both of you. Go ahead.
Yeah, a lot of us think that the progressive tax was a huge mistake even before this crisis came along, because what we need is reforms to how we spend money. We need pension reform, spending reform, lots of different reforms. And taxing our way out of the never going to work, because people keep leaving. And the bottom line is that people keep leaving. They're not happy. Now the holes are so big and so dramatic that taxing just becomes a joke, right? The whole world is cutting taxes, trying to help economies grow again and provide relief. And so we would be the one place in the whole world raising taxes. So it would be a silly thing. I think that he's going to, Pritzker's going to get a lot of pushback for that, but don't think he won't try. But taxes will just make things worse.
Ted, can you speak at all to the lawsuits that the governor is facing? We have a question. Do you know where to find documentation describing the reasoning behind the restraining order? Will you be posting these things on wirepoints.org potentially? Yeah,
so a lot of what I just talked about, the charts I showed, we released today, so you can find that on our website right there on the top, but we can share it, Beth. That's one. Two, as far as you were asking about the lawsuits and the governor. Mm-hmm. Yeah, so Darren Bailey is a downstate state rep, and he filed a lawsuit, and he won. He won that suit. It's of course being appealed by Governor Pritzker. Now he won, so only he's the only one that's not restricted by the executive order that's in place now. But what it does is, of course, it'll be fought. We have to see what happens, but it does open the door to other people to sue. We're wondering if somebody can do a class action suit instead of all of us having to sue individually. Maybe a class action suit can happen, but we have to wait and see where this one goes. But there's also other suits that are very potential, and one in particular where people may be able to sue if they've been restricted from travel, because they may be able to say that their livelihood was hurt and actually sue Governor Pritzker for damages. So it becomes very interesting, and I think you're going to see more and more of this. I don't know how it's going to play out, but certainly there's going to be, I think, pretty good cases for lawsuits in many different ways.
Okay, so thank you. Question now for both Carrie and Ted. What do you think of the Swedish model and the fact that, as you know, in Sweden, they did not slow down, they did not shut down the public schools? I know that I've heard them argue that they are having higher death rates in some neighboring countries, not as high as any state here, but the reasonable level of their shutdown will allow it to continue over the long term versus all or nothing. So, Carrie, why don't we start with you on that one?
Yeah, I think, that it's sort of advocating for what Ted was going into more deeply. Yeah, I think that, they took the approach of just trying to, protect the most vulnerable that were at the highest risk. And I think that, hindsight's 2020, or you can look through things with that certain lens. I think the point is what Ted was saying is here we are now. We took the approach that clearly, the president, got information that like if we didn't do social distancing and aggressive measures, that the hospitals would be overwhelmed and there wouldn't be enough capacity to care for patients and save those who could be saved. So that was a decision made at that time, so I don't think that there's useful to sort of go back on that. It's already done. The question is, what do we do now? And so I think what's interesting about the Swedish model is it gives us data on that approach, and saying, look, you can have the economy be active, but try and sort of, help the most vulnerable. We have a much more diverse population. We have a population that is much sicker in certain segments, like the patients I care for on the South Side. So I think, the comparison, breaks down, and our healthcare system's different. So I would say, that I like what they did because it helps inform us moving forward.
Mhm. Ted, do you want to speak to that?
Yeah, I might add just a few things. It's going to take us a while to figure out what really perhaps would have been better, what we could have done, what we couldn't have done. And like Carrie says, we don't know, so we all acted in different ways. I think what you're seeing from them so far, since things are holding up, is that they're going to be, well, they can say today, it's too early to judge, and we have to be smart about the data. But so far, they can say that they preserved civil liberties. It's something that they really wanted to do. They kept their economy going. They knew they were going to have deaths. We're having deaths, even though we've had a shutdown. Maybe they would have been worse, although there's people challenging that. Some people are saying maybe the shutdown is making things worse. Nobody ever promised that the shutdown would result in fewer deaths. The big promise is that we wouldn't overload our hospitals. That was the promise, but it was only about flattening the curve and spreading it out.
Repeat that, because that's interesting. Nobody ever promised that the shutdown would lead to. I guess I thought they did. I thought that was part of the promise.
Well, all we did was flatten the curve so that we wouldn't. Right. We instead of having a big peak, we flattened the curve and had a peak of deaths for a longer time, kind of thing. So, because we didn't have a way of stopping the disease itself. All we could do is avoid having the hospitals be overloaded. So, we don't know how this will all play out, but I think that what we do know now is that it's not the killer. It's not the killer we thought it might be, and we're learning that more and more. So, back to Carrie's point, I think we're getting enough information, enough data to start to say that. Come on, Light. That nope. There you go. That we have enough information to start to say that we can be smarter about it, and we have to phase things in.
Okay, so now a question for Ted. Can you talk a little bit about the idea that states could file for bankruptcy? Would that help us? And then also, if you talk about the politics of this, Carol wants to know how we can lobby our state to open up some of the political arguments and the constitutional approaches. And is there some limit to what Governor Pritzker's power is to shut down businesses? Because it doesn't seem like he thinks there's any.
So, if you listen to me and a few others, we've been complaining about Illinois' finances for a long time. We've been predicting this. People thought we were, sounded like broken records. And what's happened now with this crisis, it accelerated the problem, and here we are. Now, the only difficult thing about discussing Illinois' financial problems is it's all wrapped up in the coronavirus now. And, lots of states are having trouble. Nobody's having the trouble we are. We're the first one to actually write a letter to the Congress saying, could you please give us a bailout? No other state has done that yet. And so our problems are real. And when Senator Don Harmon here from Illinois wrote that letter, we happened to get a leaked letter and we broke the story. It got, to the rest of the senators in the rest of the country. And people started to say, wait a minute, why would Florida or Tennessee or Georgia bail out Illinois' problems? And that led to Senator McConnell to say a few days ago that maybe bankruptcy is the way for states to go. He's caught a lot of grief for that. But what he has done is he's opened up the door to how sick Illinois is and how reforms are needed. And what you'll start to hear is more and more that Illinois shouldn't get money unless it promises to reform certain things. And so there's a lot of politics going on, a lot of senators in the U.S. talking to each other, arguing about how to do this. And the good news is that we're having the big discussions. God knows how it ends. But I think Illinois is running out of options. All the can kicks they used to do, they're really hard to do now. And they can't borrow money. And the rating agencies are watching them. Everybody's watching. So this is a pretty special moment. Hopefully we can turn this into reforms and making Illinois a destination state again.
Yeah, hopefully we can make it so that we don't let this crisis go to waste. So Carrie, can you talk just a little bit about what your colleagues in the medical world are thinking? Are they thinking that the policy, if I'm reading the question right, if the policy is about opening up or not opening up, is it about right? Are they frustrated mostly on one side or the other? Are they evenly split? Can you talk about that a little bit?
Sure. So in the emergency medicine community, now that we're, have this experience and know how to handle it, for those of us who, like, when we go to work, we're just, it's COVID and we feel comfortable with managing it. We feel like, it's safe to reopen, with smart precautions. But for doctors who are not at all dealing with COVID patients, they have a lot of fear around it. We have consultants that like won't come to the ER who normally would under a situation. So sort of, yeah, with that, because they just really don't have, the experience with it, or haven't, because they've shut down elective procedures and whatnot, they're just like not in the hospital. And because of virtual visits, doctors aren't actually like physically, potentially coming in contact with someone who, so it's like really, depends. If you're dealing with the patients, your ER or ICU, I think we feel like there's a way that, it can be handled and managed. So I think kind of reopening with elective procedures and things like that, I think more physicians will feel comfortable and see how it's, all handled.
So I just want to mark the time because our event was till 7:45. So we are happy to stick around. We have the line for another 10 minutes or so. For those of you that need to drop off, I just want to say thanks for attending. We will do another call in May, likely about education, because I think that is heavy on people's minds, as Governor Pritzker hinted that we could be looking at e-learning in the fall again. And we're also going to have a short survey coming out, so please look for that in our newsletter. And we'd like your opinions on some financial and other questions. And you can, again, sign up for the newsletter at newtyourneighbors.org. So I want to officially thank Carrie and Ted and Betsy and all of you and everybody for attending. If you need to drop off, please do. We do have some more questions, so we're happy to answer those.
Okay, great. Yes, thank you, Beth. We're trying to get everybody in here, but we've got a lot. So if you can go back, let's see, it sounds like you were saying, Michelle says, it sounds like you're saying COVID has become very political. So we have some people, Michelle is saying she's been on the trading floor for 25 years and has never seen anything like the media coverage that is happening right now affect the volatility of the market. Is there any way that we can get this chess game between the politicians to stop?
Well, I can
Oh, go
attack
ahead, Ted.
Yeah, Ted, why don't you start?
Yeah, getting the politicians to stop this this game, no. It's full throttle right now. I heard that when McConnell mentioned bankruptcy, and of course, he's a Republican, and the red states like that because they don't want to bail out Illinois. Well, then I heard that the other side, who wants to support the pension problem and all that in Illinois, they went just as crazy the other way and said, now we want even more money for all these states. So it's going to be a big fight. And, there's a lot at stake here. You've got to, no matter what your thoughts are of Illinois, it's a very big, powerful government. It's very corrupt. Nobody's been able to break the machine, but it may be that the coronavirus is what finally gets the machine, because as long as it has money, it continues to operate. But if it runs out of money, if it can't raise money from the bond market, if it's trying to get bailouts, if it's bankrupt, it might be what finally forces the reforms. And that's what we need. It's a sad way to go about it. You'd like to think that our politicians would get together and do the right thing, but sometimes it takes a crisis, and that's I think what's happening now.
So Ted, also to you, if I'm understanding the question right, if we don't get a bailout from Washington, if Illinois does not, what are we going to see cuts in services? Are we going to see higher taxes? All of the above. What is that going to look like? And one other, you can answer at the same time. Has any state employee or teacher lost their job? And if not, should they? I
think this is the biggest problem we have in Illinois, is that, and it's become very clear in this crisis, we have two classes of workers. The first class is the public sector class. It gets guaranteed contracts, long-term contracts, guaranteed pay, guaranteed pensions protected by the Constitution. The second class is the private sector class, in this crisis, they're all losing their jobs, they're getting pay cuts. It's a really ugly period for them. And at the same time that's happening, they have to continue to pay for the benefits of the first class, I said. And so it's just not fair. And it's not that we wish bad for public sector. It's just that there needs to be kind of a fairness between the whole thing, and there needs to be shared sacrifice. And if there are no cuts in spending, if there's not a reduction in the cost of government, that means that ordinary people are going to have to pay even more taxes to pay for what the shortfalls. So it's an unfair thing. We haven't seen any, both Pritzker, Lightfoot, Preckwinkle, they continue to say no layoffs. They can continue to say no wage cuts. It even seems like the raises are going to go through. And so we're trying to put more,
even no putting on hold of the cost of living increase.
Exactly. So we're trying to put pressure on that because it's not fair. Otherwise, we're going to have massive tax increases or chaos.
Incredible. Okay, back to Carrie. Will the vaccine, Jordan wants to know, will the vaccine for COVID-19 be a cure-all, or do you think it would be more like it'll get worked into the annual flu vaccine? Kind of like,
Yeah, I think the latter. Yeah, sorry. I think the latter. I think sort of focusing on the vaccine as some, endpoint that's going to like change everything. I really don't think is the right way to look at it. I think this is just here with us to stay. And that's why I think what, Ted is talking about restarting the economy and all of us thinking about it that way is really important. This isn't, going to go away. This is just going to be part of the sort of, illness in the fall with the flu. This is going to come back. The thing is that we know how to manage the hospital. We know how to, manage. We do have, great supportive care. And so I just think that, the vaccine will be helpful, but like the flu vaccine is not 100%. And there's still no vaccine for HIV. HIV is now a chronic disease, which is wonderful. It's not a death sentence, but there's no vaccine for HIV. So I think, it's great they're working towards that, but I wouldn't look to that as some sort of endpoint to say, oh, well, when the vaccine comes, then we're going to restart things. That's just not like, that doesn't even make any medical sense. And I just wanted to quickly say on the issue of like, what's going to force Illinois' hand. I personally, from just working with everyday people from all spectrums of life and being on the South Side, I think it's just going to be, I think the shutdown is going to stop it because of civil disobedience. I mean, there's already people out doing things. It's not realistic to think that they're just going to stay in their house and not go out. So that personally, from the standpoint, I'm just starting to see, younger people out and about with a lot of just, I've already had a couple gunshots,
Right.
So
yeah, and I my own view is that part of this is really going to impact the legitimacy of government. So if they don't do this right, if it's too severe, then the risk is it will have a huge impact on whether or not we respect government down the road when either another crisis comes up or just in general. And so we're really kind of playing with fire on this one. Carrie, why don't we let you wrap up and then we'll let Ted wrap up. Anything else you want to share? And I had another question. I've heard this now a couple times. Are you being asked to default deaths that are uncertain to COVID if you don't actually have a test? And then just in general, what can you tell people to lessen their anxiety about this as hopefully we do eventually begin to have to lighten the shutdown?
Yeah, I mean, I've never been. So I don't know where that whole thing is from. That is not at all something that occurs in the hospital. So that's just
testing. Does everybody in order to be able to say it's a COVID death, do you have to have a positive COVID test?
Yeah, I mean, the ones that are COVID deaths are so I've had like the past week, a couple people coming from nursing homes who they said, well, they're COVID positive and then, they die. And so they're considered a COVID death because they have the diagnosis. They don't test dead bodies. Is that kind of what I think that's yeah, they don't. I mean, when someone comes in, they get the test. When you're admitted to the hospital, you get a test. you know, and so, yeah, but I'm not asked to like, just like guess, do I think that was COVID? And now I write COVID on the chart. That would be fraud. We don't do that. And so I would say that I would be, you know, optimistic, because if they so I think the medical community has done an unbelievable job. The federal government, I mean, the things that they have barriers they've broken down are things physicians have wanted for years, especially since the digital revolution. So telehealth, where, you know, there's things that you shouldn't have to go to see your doctor. There's licenses across state lines, you know, because they thought there'd be a big surge. And I have had friends who've gone to New York to help, you know, so all those things are wonderful, that have things that should have changed so long ago. And the medicine, for all the bureaucratic problems, the best doctors are here, and the emergency medicine is, you know, excellent people that know what to do. So if you got really sick, God forbid, there's excellent care here. But I feel like you should know that we have our arms around this, and that it's, you know, I think it's safe to resume things with, you know, the precautions, especially for the high risk groups. I think it's just up to us to try and get the government, you know, you know, to sort of, you know, meet our needs with restarting the economy.
All right, great. Carrie, thank you so much for all you're doing. Ted, why don't you just anything if it wasn't asked or that you want to share as you kind of wrap up and close us out for the night?
Yeah, I think my comment is, you know, we're Nutria neighbors, and you know, I think we all love where we live up here. It's a great place, and it's a, you know, everything's great about it, but we have a real risk to, I would say, our livelihood, to our home values, to, you know, whether our kids will stay in Illinois. There's a lot of problems here, and this one is going to really bring it to a 4. Let me do this again. And so,
what is that, like the clapper? What do you have going on there?
There's a light here. You guys can see me, right? So,
yeah, we're fine.
So there's a real risk, and you know, I think it behooves everybody. I don't care what side of the aisle you're on. You got to get engaged. You got to understand this problem, and if we're not careful, too many people will leave Illinois. Our home values will suffer, and we just won't be happy campers. And so this is a moment to really get engaged. And it's a scary time. It's a difficult time, but you know, all our finances are wrapped up with health now. And but get engaged and you know, push back on what you want to push back on. But at least get to know the facts, and we're happy to help in any way we can on that. Thank you, guys.
Okay. And you are at wirepoints.org, right?
Wirepoints.org.
Okay, great. Thank you both so much for a great evening. Beth, back to you to kind of close us out and say goodnight to our many panelists and to our community tonight.
Thank you again. Again, check out more information about Nutria Neighbors at nutrianeighbors.org. I think there might have been a couple questions we didn't get to. We'll do our best to answer those, and they might be good fodder for an article you might see in WirePoints. And at any rate, thank you again for joining us. Look for more information on our next virtual meeting, as well as that survey, and stay healthy. Thank you.
And you can also email us at nutrianeighbors@gmail.com. So thank you all for joining us tonight.
Thanks.